March is Colorectal Cancer Awareness Month. The importance of screening is something that has come to light over the last several years, with very high-profile people losing loved ones to colorectal cancer. According to the Colorectal Cancer Alliance, colorectal cancer is the second leading cause of death by cancer in the United States. 1 in 24 people will be diagnosed with colorectal cancer in their lifetime. So the importance of screening and early detection is very, very important. Colorectal cancer is highly preventable with screening and is also highly treatable if caught early. Previous guidelines used to be start colorectal screenings at age 50. However, there's been a rise in the cases of young and middle-aged people in the United States. So that has caused the American Cancer Society to lower the screening age beginning at age 45. So most major insurance companies, if not all, have caught up with this. However, we can go into that later on, but if you have a problem, all you need to do is tell them that that is the American Cancer Society's recommendation for screening. What are some things that we want to talk to our patients about who are have some barriers to getting tested? People find a lot of reasons, we won't call them excuses, but they are a lot of reasons to not get tested for lots of things, whether it be a colonoscopy or other things. But colonoscopies do cause a lot of fear, fear of anesthesia, fear of what if they find something, what am I going to do then? Fear of knowing the answer. A lot of people go into the test knowing that something may be going on, and they're not talking about it. They're not telling anyone that they've had some blood, or they're passing mucus, or their stools have changed and it scares them. They just don't tell anyone because they're afraid of the outcome. But there's no way for us to help them if we can't get them to get tested. So for those folks, maybe offering the stool test first. I have a colleague who said that her spouse didn't want to get the colonoscopy, flat out refused. And so she went ahead and convinced him to do the stool test, and the stool test came back with some positive results. So that person had to go in and get a colonoscopy anyway, but they were more prepared, I think, and better understanding at that point of how important it was once they got a positive result. So sometimes it just takes explaining to people and letting them know that it's the importance of it, because if there is something there and they get it early, it's highly treatable and curable even at that point for many people. Logistics is an issue for some people. They don't have maybe a loved one or a caregiver or a friend or anyone who can take them and pick them up because they give you anesthesia. They will not let you leave without a ride. There may be some cases that are extenuating where they can get, a cab home or an Uber, but most places are not going to release that person or even let them come in to get the test done without a ride. So that may take some doing on your part to help them make arrangements for that to be taken care of. And then some people just don't find that it's a priority for them to get screened for colon cancer. They have other things going on in their life. They're really busy. They don't have time, whatever other reasons they give you. Explaining to them the importance of it and the fact that 1 in 24 people are diagnosed with colon cancer may encourage them to take the time to get it scheduled. It's a whole day off of work for most people. And the day before, because you have to do the prep, or at least the night before. So being prepared in advance and making sure that they have all those things set in place will help to alleviate some of those worries and fears and excuses. Some other issues are financial. Screening colonoscopies are just that, screening. Every major insurance company should cover it as a screening, just like women are covered for mammograms. However, there are some plans that may, for whatever reason, want to not cover that. But that's something that you have to work through with the insurance, and you can help your patients and advocate for them, even if you need to do some calling yourself to the insurance company. That's something that you can definitely advocate for, even with them on the phone, and just talk them through making sure that they're saying the right things, or give them the CPT code, the billing code for that, so that they make sure to tell their insurance, this is what I need to get done, so that there's no issues. But people that are uninsured or underinsured, there's a lot of those people, and unfortunately there aren't a lot of programs out there that provide free colon screenings to uninsured or underinsured people. So seeing if they're eligible for maybe other assistance, Medicaid, Medicare. Medicare covers that, but a lot of people don't want to get things done because they don't have insurance. They're waiting to qualify for Medicare or Medicaid, or they're waiting for they're going to start this job and get new insurance. So some barriers, you're not going to be able to get through. You just have to talk that through with them and explain to them the importance of, as soon as you get this insurance, we need to go ahead and get you set up for a screening as soon as possible. Finally, a lot of people feel like they have to have, they don't have a doctor, I don't have a primary care, I don't have a GI doctor or whatever to make that referral for me. That most people, unless they have an HMO, can self-refer. It's a screening colonoscopy. They don't need an order. They don't need to be referred in most cases. It's just something that they can call. I did it. My husband did it. Called and got ours set up at a colonoscopy facility. And a doctor there was assigned, and they did it. So, but you can also get referrals from providers. Try not to let people talk themselves out of going to get screened, because it is really, really important. And then, what can we do in addition to those things to continue to encourage people to get screened? Find out what their barriers are. Find out what their reasons or excuses are for not getting screened. Maybe it's something, maybe not silly, but maybe it's something really simple, like they're scared to death that they're going to get bad news. That's something that hopefully you can talk to them through, the importance of it. Maybe they've had a family member who's died from cancer in the past, and they're terrified of finding out that they have cancer. Well, they're not going to know if they have or don't have anything until they get screened. And so hopefully they don't, and they can set their mind at ease, and you kind of help walk them through that process and what that looks like for them. Early detection, if they do in fact have something, a polyp or whatever, or they find a lesion, the quicker they start treatment, surgery, whatever the doctors decide, the better their prognosis is. We all know this in the cancer world. That's the most important thing. And then if they have questions about billing, finances, things like that, ask them to call their insurance company. Give them the billing code, or tell them what they're going to have done. I'm going to get a screening colonoscopy. What's my responsibility? Hopefully it's zero, because again, it's a screening, just like mammograms. It should be covered by our insurance. But sometimes that conversation has to be had so that they can be put at ease, or have them call a facility where it's been scheduled and talk to the financial person there and have them explain to them, this is going to be covered by your insurance at 100%. You don't have any responsibility. And if they do, a lot of places will work out what that looks like. If they have, a couple $100 or whatever for something that's not covered, I can't imagine what, but they just need to talk about it, right? They need to have that conversation so that they can appease those fears and move on to the important thing, which is getting screened. I hope you've enjoyed this talk. See you guys next time.